Suicide, depression, substance abuse, all symptoms of an underlying disease of despair.
You really can't deliver the holistic care that even addresses the physical health needs of the population without really understanding what's going on emotionally and behaviorally with that particular individual or community.
The Latino population is one of the fastest growing in the United States. The U.S. Census Bureau estimates that nearly 20% of the U.S. population is Hispanic, and that number is expected to grow to nearly 30% by 2050.
So in order to effectively serve them, you have to have programs that are designed, researched, and evaluated for that population, so you have a better match.
In 2000, a National Congress for Hispanic Mental Health was formed to address the growing needs for the growing population. Among the early leaders of the campaign was Peña Blanca resident Fred Sandoval.
I live in New Mexico. I had the opportunity to work in Washington, D.C. We decided we wanted to do the work here in New Mexico.
Building on his 40 years of experience with Latino behavioral health, Sandoval saw the birth of the National Latino Behavioral Health Association in 2002. The organization provides national leadership and advocates for mental health concerns among the Latino population throughout the country. Here in New Mexico, one of the association's missions is focused on fighting a growing problem of substance abuse.
We now have youth that are showing high percentages of consumption in the use of fentanyl. Our youth are being exposed to a drug that is going to have significant impact on their lives.
The organization did an independent epidemiological study covering northern New Mexico. They estimate more than 300% increase in the use of fentanyl among Latino youths. It's a big concern, especially since access to preventive services can be sparse.
Only 1 in 10 Latinos in the United States over the age of 12 have access to substance abuse services. 1 in 10.
Another issue facing the reach of care for Latinos is a language barrier. Oftentimes, patients can't effectively share their symptoms or concerns with a healthcare provider, thus expanding the chasm and distancing a patient from vital care.
The whole idea is how do we build their knowledge base, their capacity, their effectiveness at providing quality care that is culturally and linguistically relevant to individuals who, because of their cultural background, are experiencing particularly significant issues that really impact their well-being.
These challenges are now addressed through a grant awarded by United Healthcare.
Working in these communities, collaborating with these community organizations, really gives us the best opportunity to make an impact and a difference.
The grant will focus on training interpreters who will act as a bridge between providers and patients, ensuring their needs are met in an effective manner.
And that also increases the likelihood of the agency being able to serve Latinos as opposed to putting them on waiting lists and running the risk that people then fall off the waiting list for waiting for too long for services.
The grant will also help in substance abuse prevention services, reaching more young Latinos who may be at risk for developing addictions to alcohol, opioids, and other dangerous substances.
This means a lot to us, and this is an investment into the future of New Mexico's children.
The National Latino Behavioral Health Association is compassionate and passionate about serving this particular population. They care about all New Mexicans, but they're really oriented toward making sure the cultural needs and expectations intersect with the healthcare delivery system in a way that drives better outcomes and better value for that community.
It's a community that continues to grow and play a vital role in the American economy.
We have a lot of folks who are doing essential work who are from the Latino community.
And a vital role in our nation's identity.
What we want to do is advance partnerships that help ensure that NALBA can be of service to communities, to states, to counties, and our nation.